Welcome to the HITea with Grace podcast, where we spill the tea on HITea. Today, I'm honored to welcome Pam Russek, Chief Operating Officer of PNT Data. Thanks for joining me, Pam.
Thanks for having me, Grace. This is really exciting.
So exciting. Can't wait to learn from you. So tell me a little bit about the career journey that brought you to your role today.
Sure. It's a bit circuitous, but I actually started out in a private psychiatric setting, which taught me a lot about myself. But from there, I landed in one of the precursors to one of the major payers today, Connecticut General Life Insurance, which is known as Cigna today. And I spent the bulk of my career in various payers along the way, and eventually moved into some vendor space and moved out on my own and did business development, moving technology entities into healthcare, both on the payer and provider side. And then ultimately, before my retirement that I've come out of, I went to work for another vendor in the healthcare space. So it's been a really interesting journey. The thing that I like about it is that I've been big in big corporations, I've been in tiny places, and I've been a solo practitioner. And I feel like I've seen the healthcare industry from what I call the arena perspective, every seat in the stands. So it's helpful.
Wow, so helpful. And we're thrilled you're out of retirement. So I can't wait to dive more into that. But tell me, when you're thinking about the industry as it is today, what are some recent trends in prior authorization innovation that are really standing out to you from all of the different perspectives you've shared now in the industry?
Well, prior authorization is, I think, as the industry has got a lot of buzz around it, CMS is really pushing hard on it. Prior authorization is one of the biggest pain points that we have in the industry, clearly, and it frustrates everybody from the care deliverers to those of us that are patients and anyone who has to oversee our care. And so what's going on typically from that perspective is something that I like to talk about relative to how we spend in our country the medical dollar. So primarily what's going on in prior auth right now and what's even being dealt with from a governmental and legislative perspective has to do with how do we decrease the administrative burden? How can we get a prior authorization approved more quickly? How can we get it to be more clearer in terms of what we're looking for and what we get and what we do with that? And so the focus is really on shrinking the administrative dollar. And in addition, it's focused on like speed, it's focused on rationale, and it's focused a bit from a legislative perspective on how we connect. So there are going to be legislated ways, at least from any business that touches CMS, ways that we need to communicate in APIs. So a lot of progress being looked at and made in that capacity. And additionally, within a payer or a provider, there are things being done, especially in the payers that are larger or the providers that are larger, to actually use AI and other things to trim down the efficiency in terms of even how their own people handle paper or whatever. But I think the bigger piece of what's going on from a prior auth perspective, in my mind, has to do with data enablement, and it has to do with the medical component of our spend. And today, you and I can see a physician, but it's very difficult in many cases if we have specialists, because most of the time you have to repeat the data you need to give to them. They have to go other places to try to get that data. The data is not in the same formats. It comes from different sources. And so it is a really complex sort of procedure to get your prior authorizations done from that perspective. And your care delivery is interrupted tremendously along the way because it's such a stepped process. And I think I saw something recently from an AMA survey where doctors said that they thought that 93% of their prior authorization work was slowed because of administrative staging.
Wow.
And then I think they also were talking about an 82% abandonment rate for those of us that are seeking care because we just get so frustrated, we say the heck with it.
Makes so much sense.
Yeah, it's really kind of alarming in terms of what the impact of that can be. And when we talk about our healthcare system and how effective it is and what kind of care we get, a lot of it's tied up in just how difficult it is to get data, understand the data, and be able to talk about the promised land, if you will, in terms of this is where we'd love to get to. I go to my physician and he or she has everything at their fingertips. I know what's going on with me. I know where everything is. And it's much easier to diagnose me, determine what care to give me, make sure that I get it quickly, and that I stay true to my regimen if there is one. So to me, the most exciting things that's going on in prior auth is not so much, it's good that we're working on the admin side, but the promise of what's to come from a data enablement perspective to me is so much greater in terms of this is where I feel like the world can come together and do a better job, the world of healthcare.
Absolutely. It's an administrative challenge, like you said, but it's a data challenge. And that is kind of how the industry needs to see it in order to fix this business problem, right? And beyond.
That's right. That's right.
Yeah, I love that. So when you're thinking about healthcare data innovation beyond prior authorization, as the expert you are, what are some trends that you're seeing emerging in this space as we're thinking about it that way?
So again, a lot with data, a lot has to do with, a big thing now is AI, and it's it's a promise and it's also a curse in terms of, first of all, just thinking about the data. We have to think about, where's it coming from? Is it secure? Think about just your own medical records, for example. The data that it pertains to you, Grace, sits probably with a physician. It's probably in a billing area, more than one billing area. Maybe some hospitals have it. Maybe some labs have it. If you think about all the entities who have pieces of the same data, even like a blood result, and where it sits, depending upon who goes to get it and where they get it from, it may look different. And so when somebody tries to then look at your data together, there's a problem because the data provenance is varied. There's bias in like the components of how AI will treat it because of it. And so it's difficult to do the kinds of analysis, if you will, when we start to look at me and others who look like me, and a physician wants to say, I see that this particular medication doesn't work as well with people who have these side effects or whatever. It's difficult for them to do that because the data they get doesn't really fit together or come together. They have models to do it. The models are great, but the models can't work properly because the data isn't synchronized in a way or formatted in a way that they can actually put it together. So in my mind, again, this is where I think there's engineering kinds of things that we can do enabling AI that will then advance where we are with healthcare delivery, healthcare diagnostics, healthcare analytics, you name it. There's so much potential here, but it's like at the door and it's knocking and it just can't get in.
Yeah, absolutely. It does seem that way, doesn't it? So what are some of those trends in data enablement that you're seeing or that are kind of driving the future of healthcare progress?
Well, we're beginning to see people taking a look at exactly how we can collect the data and get it be data agnostic in terms of format. Okay. So we can take it in one format, but if it needs to be in a different format, we can make that happen. That enablement, that engineering can happen so that by the time it might be something that's vanilla, but by the time it gets to where it's supposed to go, it's back in a bean format. It's not in liquid. It's not whatever. It's just in one particular format. So it can be used for a variety of things. The other piece that we're starting to see is within a payer, particularly, every functional area that needs claim data is like, well, if you have that, can I have that? Because I need it for, let's say, an appeal or a grievance. I need it for just generally thinking about how we determine our benefit programs going forward. There's information that help us think about who we contract with based on claim data. So lots of places beyond just when you think about, okay, well, it's a claim. What's it going to tell you? It's going to tell you what happened, the diagnosis and what got paid or where it's supposed to be paid. But there are so many more uses for the exact same data within the same house. And that's where we're beginning to see people go, wait a minute, if we can get it in here, let's start thinking about how do we disseminate it in the same way everywhere. So, and typically the model has been in the past, everybody had their own pipe. So even though it was the same data, it didn't necessarily represent the same thing.
Very true. It makes a lot of sense to me that, that these are very natural areas for current transformation. And when you're thinking about kind of the future too of health IT, I would be remiss to have a leader like you in front of me and not ask you, what are some of the innovations that excite you about what could become or what could happen here in this space, especially in spaces like using AI in creative ways?
I mean, a lot of the promise in my mind here is around, I love the idea that I could go anywhere and because I need to be treated or seen for something. And it doesn't really matter that I'm in a different place than I might have been when I got my last treatment, but everybody has the exact same information. And if they really wanted to verify something, they would know who to call to say, I've seen this. I have her here. I'm thinking about this. What's your thought if you were seeing her right now? And so there's a way of like really making sure that when I say the promised land, that any of us, whether we have a cancer condition, whether we're healthy, but we're seeking advice on something else that would pertain to our health, it's just such a more integrated view of who we are and what we might need. And I think one of the really classic examples in terms of being a patient is around medicine and drugs and how they're used to treat us. Today, a lot of what happens is you get blood work. People say, okay, well, you probably need to be on this. We'll try you on this dosage. But you're treated sort of like by algorithms, and they're not wrong about the general population with this thing needs this thing. Over time, we're going to be able to do a much better job of saying this. It's not just about the genetic side. It's even about what are all your attributes, just pure and simple, that would say, yeah, ordinarily we would give you this, but for you, we would want to use that. So it excites me. And that's one of the reasons I came out of retirement, to be like so close to how is this evolving? Because as I age, these kinds of things are really kind of important. So
absolutely. And it seems like the evolution is just exponential by day, by year. And my listeners love to hear about what's going on in the space, and we love learning from you about what's happening. And it's really awesome to get your wisdom on that side of things. But we also love to learn about you as a leader. And so I'm wondering, what inspired you to come out of retirement, and why was this the right moment to do so?
Well, there are a number of factors, but the first one probably is right before I was approached, I received my 13th letter notifying me of a breach of information that had my healthcare information in it. So I was like, I'm just so tired of this, because initially you'd think about, well, should I sign up for the protection and all this other stuff? But after a while, you get to a point where you're completely desensitized, and it's almost a way of living that, you're going to get a letter or two at least during the course of a given year about this. So I came out of the retirement because one of the reasons was because it was a small company. It was focused on data and how data is being transmitted, with an emphasis on security and not retaining it. So many companies today that offer services, clearinghouses, move data, but some of them either use that data to turn it into different kinds of products, or they provide it to people who do. But in this case, the emphasis has been on just making sure the data stays protected, doesn't sit anywhere, so that it goes where it's supposed to be, so that the people who've owned it to start with, a provider, for example, and a payer who receives it, they securely have it in their space and it doesn't sit anywhere in between, and we don't keep it.
That is so critical. And I can totally see why that would say to you, like, yeah, I need to be a part of this transformation happening. And you've had successful career in large payer organizations, like you mentioned. So what made kind of a smaller health IT company more appealing at this stage in your life?
Well, it's interesting because every sort of experience I've had, large to small and say even solo, they all have a good side to them. They all have a challenging side to them. But this particular opportunity was, as I looked at the culture, we're a team, and it's small enough that, it doesn't really matter. You can talk to anybody on any day about anything. Oh, we have this problem. I want to get so-and-so's perspective. You could just pick up the phone. The titling thing isn't really that big of a deal. People call all the time, talk to the C-suite. We talk to the people that are entry level. And so it was communication-wise, I felt like it was a good place to be, to try to drive quickly. And there is a reputation here for high level of customer service and a high level of nimbleness. So that was also another reason to be sort of attracted to the size of the company. And also, I think the final thing in terms of size is just that for me, from a competitive spirit perspective, there's a bit of a David and Goliath kind of thing to this. So it's like, all right, we're going to take this on.
there's like a level of grit you have that I can do this, and I have had all these broad experiences that I'm bringing to the table here to get this done.
Right.
And having navigated as many male kind of dominated environments you've navigated as a leader in this space, and large organizations, now small organizations, all in between, like what's progress that you have seen now that's happening for women leaders in the space? And where is there still work to be done where we can empower each other more and grow and level up?
Yeah, it's interesting that you asked that. I get asked that a lot. In many ways, my sort of counsel around this and what I've noticed over time in terms of progress is not that different within IT or technology than it is for the world in general, business in general with women. But there still is a much greater lopsided ratio of women and men in the IT sector. And of course, it dates from the original days when, science and technology was not something that girls usually thought about doing. But STEM has made a big difference. And there are many women's organizations that work, and even within the IT sector, that work very hard to begin with girls at an early age to try to drive them here. So I think that's one of the things. There's women helping women components to this. The other thing, though, and I have been so fortunate in my career, I have had some excellent mentors, and they have been men, but they were committed. And it was like, if you want to be able to do this, then here's what you need to do. And I'll never forget, one of my early mentors said to me, we were going through something and I came in and said, okay, here's what I think we should do. And he said, fine. He goes, I will underwrite you on anything. And so that gave me a level of confidence that so early in my career, I was only a year and a half out of college. And so to have somebody say that to you is like, it's like manna from heaven. You think, okay, well, this person's going to have my back, but they're also going to help me, because if I really don't know what to do, or if I make a mistake, they're going to still help me. And so it's not just that you have a mentor, it's a mentor that's committed. And then I've had some really great women mentors as well along the way. And I think that makes a difference. The other thing is that many of us who have had that experience really work hard to pay it forward. So I think there's a commitment there as well. When you feel as blessed as I do from having had that benefit, and I know not everybody has it, you want to do something. You can't really, you could thank the person, but really to make a difference, you have to help others. So those are some of the kinds of things. I think it's the other thing I guess I would say generally from a wisdom perspective. My best advice to women in business in general is know who you are. Listen to what makes others successful, including the men that you're working with. You don't have to try to be them. You have to understand why it works for them. And when you understand why it works, you have to find what makes that work for you.
So inspiring, Pam. I'm so thrilled that we get this opportunity to learn from you today. Thank you for being so generous with your wisdom. And I hope you guys all feel as inspired as I do right now. I'm like, yes! So let's go. Right.
Well, it's my pleasure.
Yeah. So as we kind of finish off this conversation, where can our listeners find you online?
They can find me online at LinkedIn, and they can also find me online at my place of business, Pam Russek at pntdata.com.
Terrific. Now, before I forget, did you happen to bring tea with you today? And tell me about your mug or your choice of drink.
It is tea, and you happen to have timed this for my morning tea break. But this mug is actually, I use this purposefully because it's clear, it's glass, and it reminds me that the most important thing I think about every day in terms of working with people is clarity. So if someone has a question, I need to make sure, do I really understand the question? If I'm going to provide a response, is my response clear? So even when it's empty and it's just sitting here, I look at it and I'm like, yeah, clarity. So that's my story with my tea.
Clarity. That is terrific. Thank you so much for joining us today.
You're very welcome.
And thanks to you folks for joining us too. Check out the HITea with Grace podcast for more great interviews with amazing guests like Pam today. Cheers.
Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.